Okay. I want to do a video on my HSG real quick because every time I went on here, I couldn't find one from start to finish without everyone's story in it. Yes, I care about everyone's story as well as my own, but I know everyone just wants to know this process. So start to finish, you walk in. For some reason, every receptionist in a doctor's office, most are like bitches. Like they're really rude. Like they don't care about you. It's their job. They see patients just like you every single day. So what makes you stand out, you know? So you walk in, no compassion in their voice, just like, can I help you? And it's like, God, Tawny, you're in the back of my video in the fridge. She's in the fridge. Anyways, I walk in. They tell me I have a copay of $500. I was pissed about that because they didn't tell me that over the phone. And then she's like, well, we said that it says noted that they told you over the phone. And I was like, okay, well, I'll pay it. But like, that's annoying because I didn't know. So I paid it. They walked, literally, I sat down in the waiting room and like, I literally sat down and they're all, Jessica, like, and I sat right back up. Like they were ready for me. I go back there and then the nurse at the door is like, hi, I'm Stephanie. I'm going to be with you throughout the procedure. And I'm like, okay. And then she's like, does your partner want to come back there with me? With you? Hell no, she doesn't. No, she was like, does she want to go back there with you? So then I was like, so I look at Tanya and I'm like, come here, you know? Oh, come here. No, but seriously, shut up, I'm doing this.
We're laughing.
Anyways, so I'm like, yeah, come back here. Come back here, girl. So I like called Tani of the sea of people in the waiting room. God, if you guys can see my wife right now, she has a freaking boli. I don't know if you guys know what that is. Let me show you. Let me show you. It's this ice cream right here.
Show the dead frog.
Wait, give me the ice cream. It's this. It's an ice cream. Anyways. So I go in there. They check me in. At this point, I'm in a waiting room. And she gives me like a surgical outfit kind of thing, like a hospital gown. When she closes the curtain to tell me to get dressed, I start crying instantly. And my crying was more like a fear of pain because every video that I looked up, girls are, hold on. I chased after her and I got out of breath. Anyways, the fear in me was because of the people on YouTube saying, sorry, I stuttered. The people on YouTube were saying that I was going to get this burning, cramping, most painful thing that like if something's wrong, like you won't even want to go back to like fix it or see what options you have because it hurts so bad. So I was like crying. The nurse comes in there and she's like, are you ready? And I was like, yeah. And she's like, it's okay. Like if you have any questions, ask me. Like, what are you nervous about? Blah, blah, blah. And she's like, well, first off, did you YouTube it? And I was like, yes, yes. And like my other doctor told me not to YouTube anything because everyone's process is different. So I made that mistake, didn't listen to her, YouTubed it. She was like, everyone's different. There's girls that say it's the worst pain of their life. There's girls that say that it's just cramping. And there's girls that like don't really speak through it. So she explains the procedure to me. The radiologist comes in. He explains it as well. Like that way we're all on the same page. I had to sign a lot of like every time they explained it, like an acknowledgement that I understood what was going to happen. They lay me down. My foot is fractured right now. So I didn't know that I was depending on my feet to hold up my weight. And I'm like a big girl. So like that hurt, like to put the pressure on my feet. But oh well, like I had to do it. And it's not like a gynecologist office where they have those things where your feet sit there. You're just on a flat table. You walk into this like dark x-ray room with a metal table and like the x-ray machine over it. So I'm on that table trying to get comfortable. They have this like triangular pillow under my butt. That way it like angles my body so my cervix are at a better angle. And while he's doing the procedure, he's also talking to me like I'm now gonna put some lube on you. I'm now gonna put I think it's called a speculum. The thing that goes into your vagina and like opens it up just like for a routine pap smear. He's like telling me when he's going to put that in there. And then he opens it up. Then he's telling me that he's trying to put the tube in. And then you kind of hear his voice like change to like a more, I'm going to try one more time. It's not really wanting to go in. And at that point, I was kind of like breathing like, oh my God. By the way, I did not feel anything go in. I did not feel like that speculum go in. It just felt like routine pap smear, like just, I'm aware that it's in there, but there's no pain. Same thing with the tube, with the catheter, aware that it was there, but no pain. He tried like 3 times and he started saying like, I'm going to try one more time, and his voice kind of changed, so it made me nervous. He's like, I'm going to try one more time, but if it doesn't go in, then I'm going to have to sit you up and we'll talk about other options we can do. And at that point, I was kind of like, oh, damn it. Like, you know, like something's wrong with me. Like what's happening? Why can't they get it in? So like, I just like took a super deep breath in and like prayed on the way out, like, please Lord, let me relax. Like, let this thing go in. And then he just like, I felt a big push in there, but it was, again, no pain at all. It was just more forceful, like get it in there kind of thing. And then it got in, then he's like, okay, it's in, I'm gonna straighten you out. So the nurse like pulls the sheet back, so that way my body's not like this anymore. It's like going flat. He takes the speculum out, and then at this point it's just the catheter in me. And then she's pulling the x-ray machine over me. And as she's doing that, he's saying that he's gonna blow up the balloon and release the ink. And at that point he was like, you are gonna feel some burning and some cramping, so take deep breaths. So I was taking the deep breaths. Before I knew it, it was over. And I was like waiting for the burning and cramping, but it never showed up. Like it never came. I didn't have any of the burning sensation or the cramping. The cramping I had was more in my legs, kind of more like period cramps, but instead of it being in my uterus, it was more in my cervix. So that's what he was saying, that people like confuse their mind on saying that the cramping, because you're used to uterus cramps when you're on your period, but the cramping in your cervix like can make people think they're like in a lot of pain. And if you think it's painful, like the more pain you feel you're in. So luckily I've never had cramps during my period, so I wasn't sure what to expect. That's why it didn't hurt, I'm guessing. Anyways, so we were done. He told me to relax and take deep breaths because you can get dizzy, but I didn't listen. I sat up as he was saying it. He's like, or you can sit up. So I sat up. He pulled over the x-ray machine like monitor and he was like, do you want to see some pictures? He explained my pictures all the way through with me. And then he said everything went perfect. Like it went through, it went out of my fallopian tubes. I went like this because they're like curled. It came out perfectly fine. And then he was like, if you have any questions, ask me, whatever. So the only thing that he did tell me was that my uterus is a little bit slanted, meaning that it was hard for him to get in. That's why the only question I had was like, Tani and I are doing IUI insemination, which is intrauterine insemination. So if it was hard to get it in there, should I look at different options like ICI, intracervical? That way it's easier for my doctor to get it in, because once the sperm is thawed and like in a syringe, I didn't want the sperm to go bad or her not be able to get the catheter in. And then now I have this whole vial of IUI insemination that's gone to waste because it can't go in my uterus because it doesn't go in. He was like, that's why we do this. I'm sending over the measurements to your doctor now. She can look it over. It wasn't a problem. It just might have been the angle, or when you're doing it in the doctor's office, you're at a totally different like position and blah, blah, blah. So that made me feel better. Then they took me to this restroom that was within the same room. It was just a door. The restroom had like baby wipes, towels, disinfectant spray, a pad, a diaper. Like I can choose what I want to use in there to clean up. And they said that the iodine, I believe it's like soapy disinfectant, like it's like yellow like iodine, and it disinfects your cervix. That way there's no infection when you're going in. It's really sticky. So when you go to the restroom, like it feels like gel on your legs. Like it's sticky. That's why there's like a towel in there. So you have to wipe it all off and then clean up. And then I opened the other door to go out and Tani's standing right there. And Tani was kind of looking at me like waiting for like me to start bawling, crying probably, I don't know. And I kind of was just like, okay, let's go. So she's like, okay, are you okay? And I was like, yeah, let's go, like, let's go. And I didn't really say anything. And then we get to the parking lot and I was like, I did not feel anything that the YouTube people said. She's saying no. What did I say?
I asked you a scale of 1 to 10. So that's what you were saying on how much it was going to hurt.
Oh, scale of 1 to 10?
And you were like 0.
Okay. I said 0 on a scale from 1 to 10 in pain. Again, on the pain thing, I felt 0 pain. On the me being aware that there's something in my body that's not supposed to be in there, I felt it. Like, I felt the whole thing, and the fact that he was talking about it while he was doing it, I felt the whole procedure, but no pain, no discomfort, just me being aware that there's something in there. That's it. But no pain. Really trust your doctor. If he's like, before the procedure, he should ask you questions. So ask him to like talk you through it. Because when he sticks the catheter in, the first 3 tries he did it, I wasn't breathing like relaxed breathing. I was just breathing normal. But the 4th try, when he like got it in, I took a super deep breath in, and that's when he got it in. So just ask him to speak you through it, like talk you through it so you can take deep breaths. Another thing I read after my procedure is to chew gum, which that would have helped me because I'm focusing on chewing the gum and breathing rather than like, oh my God, I'm gonna feel this, like tense up, tense up, tense up. So I, like after that relaxing breath, everything went smooth. I think I was just tense the first 3 tries, but I don't know. After that, I went to go eat because it was like I was fine. After I went to go eat, I drove home. We drove home, and it was in San Diego. I live in Temecula, so it's like an hour drive. I felt super exhausted, like if I got hit by a truck, but not like pain on my body, just like I was exhausted. And Tani said it was like the adrenaline from like the day, sorry, I'm looking back because I have to go to work. The adrenaline from the day like kind of tired me out, I guess. So I took a nap in the car, and then by the time I got home, I did feel cramping in my vagina, like not my cervix, not my uterus, not my stomach, but like in my actual vagina. I felt it like just like a little sharp like shock. Like it was just like a little contraction, I guess, like a cramp. But that's it. I took 1,000 milligrams of Tylenol before the procedure, an hour before, and that's all I needed. Everything was good. Yeah, if you have any questions, let me know. Comment down below or message me if you know me personally if you want to know more detail. But that's it. Okay, bye. Say bye, Tani. I don't know how to end it. Tani?
Bye.
Okay. I want to do a video on my HSG real quick. No, seriously, from start to finish, because when I came on here, I just wanted a video start to finish, no bullshit. What?
What? Go ahead.
Why'd you laugh?
I didn't. Oh.
Anyways. Okay, so I scheduled my shit. I'm just kidding. I'm just kidding. Okay, so I want to do a video on my HSG real quick, start to finish. So when you go up in there... No, I'm just kidding. No, seriously. Okay. No, I do. This is Tani, by the way. It's her day off, so she doesn't want to be seen.
Dude,
okay, shh.
Oh,
No, I'm not done. Okay, starting over. Okay, so I want to do a video on my HSG. Sorry, Tani's standing right here. Sitting right here. Eating my cup of noodle. They could hear you. Let me start over.
no.